In 1981, doctors began noticing that young men, many of them gay, appeared with unexplained symptoms, among them virulent pneumonia and a rare cancer called Kaposis sarcoma. Within a few years, the disease, named acquired immunodeficiency syndrome, also known as AIDS, it would go from a medical oddity to an epidemic. AIDS during the 80s was the gravest health crisis of the 20th century. Mainly religious politics shaped the Reagan administration's response to AIDS. One of the earliest victims to be diagnosed with AIDS was Stuart Garcia. He was a brilliant, charismatic Texan who loved going to gay dance parties. In 1985, he was hospitalized with violent coughing and sickness. Less than a year later, he struggled with 106-degree fevers and died. He was only 23. In 1986 alone, 11,932 Americans died due to AIDS. Still, the federal support was only making it a low priority. In 1983, the administration rebuffed health officials from 11 cities who asked for support to manage the epidemic. The Federal Public Health Service, whose director pledged that year to make AIDS a priority, suffered budget cuts for the next few years. In September 1985, the president mentioned AIDS publicly for the first time, but again trimmed funds for AIDS research. In the spring of 1986, a few months before Stuart's death, Reagan asked Surgeon General Koop to issue a report on the disease. Koop's report called for abstinence, monogamy, and condom use. AIDS remained near the bottom of the list still of the presidential priorities. Under pressure, the president created a committee to investigate AIDS in 1987, including several prominent conservative religious leaders. But his decision to name one gay doctor to the panel angered many of his conservative allies. The administration argued Senator Gordon Humphrey, a Republican from New Hampshire, should strive at all costs to avoid sending the message to society, especially to impressionable youth, that homosexuality is simply an alternative lifestyle. In the meantime, AIDS activists stepped up pressure on the president. In October 1987, 500,000 protesters marched in New York, convinced by a new organization, the AIDS Coalition to Unleash Power, also known as ACT UP. Over the next several years, AIDS activists would pressure Congress to substantially increase AIDS funding. In the next decade, they would embark on a massive AIDS education effort and would successfully advocate the loosening of pharmacological regulations to allow for early testing of the promising medications on AIDS patients.